Hello, everyone. Welcome. I'm Philip James from the Dr. Thyroid and the RFAMD podcast. And today, our guest is Dr. Giovanni Maury from Milan, Italy. Dr. Maury, welcome.
Thank you. Thank you very much for having me today.
Thank you for being here. It's exciting because just recently you published a book called Thyroid Radiofrequency Ablation, and you have a couple co-authors, a doctor from Korea and a doctor who practices in Dallas, Texas, I believe.
Exactly. It has been a great honor for me to collaborate with those very experienced operator in thyroid radiofrequency ablation and to release this dedicated book to this specific topic.
Well, it's fascinating because now you have co-authors located on different continents, Asia, Europe, the Americas, who come together to publish this book. Tell us a little bit about why, who's the book for, what's the content?
Yeah, it was exactly our aim to try to provide a book that was including the experiences from different areas of the world. I have some connection with those co-authors that are friends now from the United States, from Asia, and we wanted to try to make a book that was as comprehensive as possible in order to make something that reflect the most widely used technique and the most useful for readers. Dr. Park was one of the most pushing for this book. He previously released a small book on itself, and we met at some meetings and decided to proceed with this book, expanding the co-authors. Also in the different chapters, you will find different authors from all over the world. And this is, I think, very beneficial for readers.
It's intended for health professionals or for patients?
No, it is intended mainly for health professionals. It is very deep in some details. It covers from the ultrasound anatomy and specifically the anatomy that is relevant for the procedures for the radiofrequency ablations. Then it moves on the technique, including some chapters on the technology of radiofrequency interaction with tissue, and then moving on with the techniques and tips and tricks for an effective and safe thyroid radiofrequency ablation. So it is mostly aimed at those physicians that are starting the practice and need a book for that is including all the relevant details. As you know, we
Dr.
are making...
Maury,
Yes.
Why did you write this book? Is there a need for it, or what need did you identify?
We are making a lot of courses for teaching radiofrequency ablation in the thyroid. It is really an expanding field. After years where we had some difficulties in being accepted with this procedure, now the scientific community has recognized that this is an effective treatment. And a lot of physicians are looking for training. And all the time they are asking for some material, to have the slides of the presentations to be forwarded with some papers. And I was thinking the best is to collect all the relevant details in one book that can be provided to physicians, trying to cover all the relevant aspects from the ultrasound to the results in the literature. So something where really someone can find the vast majority of the informations on this specific topic.
You've been practicing thyroid ablation for what, over 10 years now?
Yeah, 12 now. Yes.
12 years. And that might be a surprise to some in the United States, where really some of the first doctors to offer thyroid ablation only came about 5 years ago or less.
Yes, at the beginning, some Italian physicians started back in the early 2000s. The first article is in Radiology about laser in the year 2000. The clinical experience was in 1998. And at the beginning, really, those were considered like crazy people trying not to operate on thyroid, while all the world was just doing thyroidectomy. Then in Italy and in Korea, it started as a more standard practice, while in the United States, it only started, I think, in 2018, being FDA approved. So yes, the experience in Italy and in Korea is now around 20 years old.
Yeah, and you know, when you're at conferences, you present all over the world. You do a lot of trainings. You have a lot of very satisfied patients that you've treated with thyroid ablation. But in all the conversations you have with doctors who now want to be trained or introduced to thyroid ablation, and you're having a conversation, say at a conference, there must come a certain point in time during that conversation where you're going to have one of your books, Sandy, and you're going to say, read the book. What are those moments? Like, what are those times where I know sometimes the inspiration for writing a book is because you keep getting almost a sense of frustration in certain conversations where you wish you could just hand someone a book.
Yeah, or some material that is comprehensive. A lot of questions, sometimes also quite basic, and it is really lovely to have something to provide those physicians. Say, okay, just try to read that from the beginning, and maybe you will have answer to 90% of your questions. Then this is my contact for any other details, or when you will start your practice, just feel free to contact me. But I really hope that will be very useful for physicians that want to start this kind of practice. Or also
go ahead. But also
for those that are some kind of practice in ablations or that want to approach thyroid and are not very familiar with the anatomical district and want to have all the proper information before starting. So not only really beginner in ablations, but as thyroid has been a little bit different than other types of ablation, I think that would be useful.
So you would almost recommend anyone who's considering attending thyroid ablation training to read the book first?
That would be ideal, because in that way they can have the basics for the theory. And during the training, we can discuss more case by case or those kind of questions that might remain unsolved from the book. Oftentimes, people arrive at trainings with like limited experience with ultrasound, some FNA, never did an ablation, or radiologists with some experience in liver and kidney, but never on thyroid. And so every time I spent quite a lot of time on the basics, whilst having people that already had the book would be, I think, highly beneficial.
And how many pages, how long would it take to read from front to back?
It is not very, very short, but I think, when I approach this kind of activities, I want to learn something new. I know one chapter is around 10-15 pages, can be read in half an hour quite easily. And so if someone decided to attend a course, want to prepare reading one chapter every 1 or 2 days, trying to familiarize is half an hour a day, and let's say overall in 10 days of half an hour can have a very good idea of the procedure. That would be my recommendation and what I do when I approach new procedures.
Is there a section or a part of the book that you're most proud of?
Yeah, there are some where I have to acknowledge that Dr. Park, who did also a lot of drawing of scheme that are very, very illustrative about the technique and about the anatomy. That is oftentimes quite difficult to teach on presentation and live cases, whilst there are a lot of good images that really well represent the procedure and the anatomy, and I think can clarify a lot some details that oftentimes can be a little bit difficult to be understood. That's the part that I found more excited of, because it's highly is a book that is highly specific, that goes in very important and deep details, but also very easy to read and with very clear images.
Listen, a link to order the book will be included in the description to this interview. However, maybe you can let those know listening or watching this interview, how can they order the book?
Yeah, it is quite easy through that link, or the book is published with Springer, which is quite a large and well-known group of publishers, and you can find the book on their website. Also, there will be a link in my webpage that is giovannimauri.com. So you can find that, and also on my social media, I will publish something about the book. So I think it will be quite easy to find a way to find the book.
Well, congratulations, Dr. Mauri. The book, again, is called Thyroid Radiofrequency Ablation. Any final thoughts before we say farewell?
Yeah, thank you very much again for having me here. I'm very proud of this result, because it has been quite a large and extensive work. It lasted, let's say, at least more or less a couple of years to put all together. And now that I see finally the book, I'm very happy and hope that this will be useful for all of those that will start this kind of practice. And thank you again for sharing this on your channel.
Very exciting. Thank you.
Thank you very much.